name is Tammy Minier, and I am the Chief Quality Officer here at UPMC, and I also have the privilege of being a nurse now for nearly 40 years. It is really my personal honor to be with you all today on this very historic moment. On behalf of the 92,000 workers here at UPMC and in the communities we serve here in Western Pennsylvania, Central Pennsylvania, Maryland, and Ohio, this is truly a momentous occasion. We will today, and I have the personal privilege to vaccinate 5 of our frontline employees. These employees are my personal heroes. Over the last now nearly 10 months, they have worked tirelessly at the front line, taking care of our communities, and have made sacrifices that we will all stand in honor of as we go forward. This moment is happening just a few miles from another historical time that happened here in Pittsburgh over 65 years ago. On April 12th of 1955, Dr. Jonas Salk took some of these very same steps. And we all know the benefit that humanity has seen from that. We today will be given the Pfizer BioNTech vaccine for SARS-CoV-2, the virus that causes COVID-19. We have had an expert panel of many clinicians across the organization guide us in the implementation of our prioritization plan. While we began with guidance from the federal government and our state and local health authorities, we have moved forward and continued to adapt that to arrive at this moment today, where we have selected our first 5 employees to receive the vaccine. We're very fortunate to have an exceptionally competent pharmacy staff. Our pharmacy team, led by Dr. Tony Patterson, has taken the opportunity to receive the vaccine this morning from UPS around 9:15. We have taken the vaccine, we have defrosted it and prepared it according to all of the guidelines that have been issued by Pfizer and the reconstituting processes that are necessary for that. So it's my pleasure to begin this process. I'm actually going to just take a seat and get myself prepared, and we will be calling up our employees one at a time to receive their vaccination. So thank you all so very much. And again, it's a huge honor to be a part of this process this morning, and I cannot thank the healthcare heroes at UPMC enough. All right, Shar, here we go. So exciting, Shar. Such a privilege. All right, Shar, let me introduce Shar. This is Charmaine Pykosh. Shar, come on up and join me. Shar is an acute care nurse practitioner with the Department of Critical Care Medicine here at UPMC. She works in the surgical intensive care unit, and she is a senior advanced nurse provider, nothing to do with her age.
Wow.
Who has worked with UPMC for over 30 years. So Shar, have a seat, please. And I want to remind folks that we do have Dr. Snyder here in the room, who is supporting us clinically to make sure that all of our employees are safe as we go through this process too, along with another physician that we're actually going to vaccinate. Now you know, relax your arm.
I'm trying.
You're trying. You're like, lady, wait a minute here.
Well, you answered a little bit.
Yeah. So here we go. All done. Not too bad. She's still smiling,
They told me to smile with my eyes, so I'm trying to do that.
and you are. You're a smiler always, Shar, with your eyes. There are those of us that, yeah, I got it. There we go.
Perfect, thank you.
Thank you very much. So there, woohoo! The first one done. Oh, they didn't take the cap off. And you know, I don't have a garbage can. There it is. Great. As you can see, we've got lots of experts making sure we're safe, following all of the rules here. So, are you going to take your jacket off, my friend? So, our next candidate is Dr. Sylvia Owusu Ansah. Please, Sylvia, have a seat. Sylvia is an emergency medicine physician here at UPMC, and she is also an assistant professor at the University of Pittsburgh School of Medicine, and she has been on the front line taking care of our pediatric COVID patients. So you want to let your arm rest a little bit if you can. As you know, very important that we try not to have your muscle tense. There we go. And she's still here, smiling. No, not even bleeding there, Sylvia, but I'll put a Band-Aid on just to be sure. You got to keep those spaces in good shape. Thank you so much. I'll do my best. Not used to giving shots in front of the camera, are we? So, this is Kristen Schott, who is a nurse in our medical surgical intensive care unit and a graduate of UPMC Shadyside's own School of Nursing. Yeah, great School of Nursing. Makes great nurses. He's also a brand new dad.
I am.
What's your son's name?
Ben.
Oh. And how old is he?
He is 10 months old now.
So this is his first holiday.
Correct? Yep.
Are you excited?
We are, yeah. Yep.
You should be.
First holiday, first pandemic.
All right, try to, yeah, first holiday, first pandemic. Try to let your arm relax, as you know. So, we're gonna try to keep my arm down, which is a little hard. Do you mind
Do
you
you want me to
holding
hold
that?
this?
That
Yeah,
would
sure.
be awesome. You know, these photo op folks, they want to be able to see. There. Okay. Now, sure, and you had to bleed a little bit.
No, yeah.
That's all right.
Do I get a superhero panda?
You get a superhero pin. You know, so many of our nurses just deserve, and doctors and social workers and so many people just deserve superhero
Plus it's
pins.
children's.
Plus it is children's. Maybe they're out washing the windows right now that way.
Thank you.
No, thank you so much, Kristen. Enjoy that holiday with that little boy. All right. Here he comes. Jeray Gamble. Jeray, come on up. So, Jeray made a career change last year. He used to be a greeter, and then he decided that he wasn't getting close enough to the patients.
Exactly.
And he wanted to be closer to the patients, which I totally get. Oh, isn't that a pretty tattoo?
Thank you.
That's beautiful. That really is. And so he decided to become a transporter. So he's right out there in the thick of the world, moving people around and making sure that we are all keeping and moving our patients throughout the hospital safe. So here we go, DeRay. No, don't hold that against me. So, a little bit of bleeding. It's all right.
Good float.
Yeah, you're in good shape. You're a healthy guy.
I work out a lot.
I can see that. I can really see that. I should have said that beautiful, gorgeous tattoo is on your nice, strong muscles there too, sir.
Dominant side.
Yes. There you go.
Done?
Done. All good.
Thank you.
Thank you. All right. And certainly last but not least, by any means, our dear colleague, Manny Philibong. Manny is, got to make sure we're safe. Manny is a environmental services supervisor here at UPMC, and he's been with us for 21 years, even though he looks very young. He absolutely does an incredible job with his colleagues, making sure all of our patient rooms and activities are fully sanitized in between cases. And we would be nowhere without that great work, Manny.
Thank you.
You and your team do a phenomenal job. Relax as much as possible. Here we go. They like to take these pictures. Yeah. I thank you for everything you and your team do.
Thank you.
Just making sure we stop it before I put the Band-Aid on. Wouldn't be a good picture if you got away. Okay. Thank you so much.
Thank you.
Okay. So, each of these employees, as you will know, will continue to use all precautions for keeping the rest of our staff and our patients safe. For the current period of time, they will be back in 21 days for another round with us to get the second half of their vaccine. We as an organization will be moving forward over the next several weeks of getting our vaccines out to our high priority employees first, and then working through the rest of our employee populations and to our community. We clearly have weeks and months to go, but we are so excited to take this first step today, and cannot thank these wonderful employees and volunteers who have gone first for all of their great work. And so thank you all so very much. So.
This is Paul Wood. I'm the Chief Communications Officer at UPMC, and welcome to the media portion of our COVID-19 vaccination event. To ask a question, you'll have to go to the raise your hand icon at the bottom of your page, and that will put you in our queue. I will call on your name, and to unmute you, be sure to unmute yourself on your end to ask your question. We'll try to take as many different questions from the media as we can in the time we've allotted. And right now, I'd like to turn it back over to Tammy Minier. Tammy.
Thank you so much, Paul. Good morning, everyone, again. It's a privilege to be here on this momentous day and to have my colleagues with me to be able to respond and respond to your questions. I'd like to begin by introducing Dr. Graham Snyder, who is our Medical Director of Infectious Disease for UPMC. Charmaine Pykosh, Sylvia Owusu Ansah, Christian Schott, my colleague Jeray Gamble, and Manny Philivong. These 5 employees who I just mentioned, we have received the first COVID-19 vaccines here just moments ago at UPMC and are here to help respond to questions that you all may have, along with Dr. Graham, Snyder, and myself. So with that, Paul, I'll turn it back to you for questions.
Thank you. Again, to ask a question, press the raise your hand button on your screen, and that will put you in our queue, and I will be able to go to as many different reporters as we can in the time we have allotted. First question comes from David Kaplan at WTAE-TV here in Pittsburgh. David, please go ahead.
Hello, good morning, and thanks for inviting us to be able to do this. I guess this question is first for Dr. Snyder. Big picture, can you just, knowing what we know about, the current supply chain of the vaccine, what's been approved so far? Obviously, today marks a momentous day in terms of the first administration of the vaccine. What, if any, projections can you make going forward as it relates to people getting vaccinated? How many more doses you'll get? What can someone watching our broadcast tonight infer of today in terms of a timeline going forward?
Well, first of all, I'd like to echo Tammy's accolades for our colleagues for stepping up and being some of the most enthusiastic colleagues that we have to volunteer to be here on camera and receive the vaccine. I don't think that these are the only 5 people in our organization who are enthusiastic about getting the vaccine. We have a lot of people who see the vaccine as a watershed moment for us in this pandemic, together with the fundamentals, masking and distancing, and together potentially with therapeutics like monoclonal antibodies that may transform what being ill means. I think we're starting to see the beginning of the end. But vaccine is just one piece of the pie, and we need to make sure that all of the puzzle pieces come together to see an end to the pandemic. And we can't see vaccination soon enough. Now, it is unprecedented how fast and how broad the vaccine efforts have been. I think it's worth starting with that. We have more vaccine candidates than anyone could have imagined. They're being developed, and they're being demonstrated to be safe and effective much faster than anybody could have developed and could have imagined. And this is a reason for great hope and confidence. Additionally, manufacturers are producing the vaccines faster and in more quantities than we could have imagined. This is reason for optimism. Now, the timeline for the distribution of the vaccines will come from our regulatory agencies, particularly here in Pennsylvania from the state, from the Department of Health. So we will get more guidance about how fast and what the allocations are of the vaccines, both to us in the healthcare setting and for people in the community. I'll remind you there are 3 phases. Phase 1A is healthcare workers and residents in skilled nursing facilities and other long-term care facilities. Phase 1B is essential workers. And Phase 1C are people who are predisposed to complications of disease, particularly those over 65 and who have underlying medical conditions. So for the public at large, you can expect to see the vaccine rollout happen through those phases that have been advised to us by the CDC. And the timing for that will be how many doses and how fast the vaccines come.
Thank you, Dr. Snyder. Our next question is from Amy Birnbaum, CBS Evening News. Amy, please go ahead.
Hi, I wanted to ask one of the participants, and I'm sorry I didn't catch all your names. What was the, what do you think that getting this vaccine will enable you to do? And why do you think it's so important to vaccinate healthcare workers first? And maybe I'll just start with the lady, with the gentleman just to the left of the doctor. Yeah, thank you. Dude, I'll just like.
This is Manny.
Hello.
Thank you. Sorry, Manny.
I'm sorry, what was the question again?
I just want to know, there are a lot of people who are saying, well, it's great that there's a priority and this vaccine is being going out. Why do you think it's so important to give it to healthcare workers like yourself first, as opposed to, other people?
Well, I'm in the COVID pods every day at our hospital. I go in there to help clean, check on stuff, make sure everything's clean to the way it should be clean. And I think it would just put me at ease knowing that, I have extra layer of protection versus, the PPE we wear. So getting that shot really puts my mind at ease a little bit more. Thank you.
Okay, thank you. Next question comes from Paul Goff, Pittsburgh Business Times. Paul, please go ahead.
Hi, thanks for the time. I am wondering if you could talk about how we got to this point over the last, 48 hours or so. You talk about, when you found out you were, after I guess the FDA approved the vaccine and what you did behind the scenes in these last 48 hours to kind of get to this point. I mean, you've only gotten those vaccines only got to into the 5 of you in the last, they just arrived like an hour and a half ago.
Yeah, thanks for the question, Paul. And what you're alluding to in part is this compressed timeline. We, at UPMC, we have taken the machinery that we already have in place in our organization for receiving vaccine, storing vaccine, distributing vaccine, identifying healthcare workers for receipt of vaccine, and going through the process, minus, of course, a press conference, which we don't usually do each year with influenza. But nevertheless, these processes are the same when we have an intervention like this, particularly annually with our influenza vaccination. So the last 48 hours actually has been a compression of these, what we do all the time anyway. Knowing from our regulatory and state body where the vaccine is coming and when, being able to distribute that vaccine, maintaining the appropriate criteria for storage and distribution, and then delivering it here, as Tammy had mentioned, through our very, very highly proficient pharmacy service, being able to make sure that the vaccine arrives safe, according to the manner in which it's supposed to be distributed and stored, and then, of course, administering it safely. So the last 48 hours has been observing that process and putting in place exactly what we knew we'd have to be doing anyway.
Next question, Megan Guza, Pittsburgh Tribune Review. Megan, please go ahead.
Good morning. Thank you so much for doing this. This question is really for any of the vaccine recipients. We've heard a lot when it comes to masks about how, it's not just to protect you, it's to protect others. And I think it's fair to say that that is relevant for the vaccine as well. So my question is just, who else in your life are you taking this vaccine for?
Thank you. Hi. Thank you for your question, by the way. So I am getting this vaccine so that I can further protect myself and pretty much everyone around me, really. I find that sometimes, in most cases, 6 feet and isn't just enough. Sometimes we need to get close to other people to give them care or whatever is required. Hugs from our loved ones or, care to our patients. It's vital that we, again, protect ourselves and are thoughtful in ourselves and have faith that we're able to do that on the level that we are expected to do. Such as myself, I love what I do. I love being a part of my family's lives and the patients' lives who I give care for. And for me, I feel it's necessary that I do what I have to do in order to maintain my position. Thank you.
Next question, Alyssa Raymond, WPXI. Alyssa, please go ahead.
Hi, everyone. I just had a question about how many doses arrived today at Children's Hospital and how many other locations for UPMC received doses this morning. So that would be for Dr. Snyder, but Charmaine, we want to hear from you too. Was your heart pounding? How are you feeling about being the first?
I'll do the first part. We received 975 doses this morning at UPMC Children's Hospital, and we are on track, but with not additional confirmation of any other doses to be received yet. We know there are 3 other hospitals that are in what they call the pre-boarding stage of the remaining UPMC hospitals. We hope over the next week or 2 we'll all be receiving doses. So with that, Char, come on up and tell them how we did.
Tammy did good at the shot, so I'll start with that. I first wanted to thank the other APPs in the critical care department. They all wanted to be first, but they voted for me to go first. So it was important. Yes, my heart was pounding. It was pounding more last night. I couldn't sleep. Once I got here and I knew that Tammy was going to give the shot, I felt much better. But I'm very honored to at UPMC for letting me do this, and we'll continue to do the proper things as far as masking, social distancing, and washing my hands. Thank you.
Thank you. Colleen Newton, WTAJ. Colleen, please go ahead.
Good morning. Quite an exciting Monday as a family member of people who have underlying conditions. This is quite an exciting day. I had a couple of questions about some of the restrictions that still remain on the vaccine. I saw an article about pregnant women might need to consult a doctor beforehand. There's an age restriction. Can you just talk a little bit about that?
Yes, so this is, again, another example about how the timeline has been very compressed with this vaccine. Over the weekend, there has been important information from ACIP, the body of the CDC, and the FDA about how to administer the vaccine and what populations to administer the vaccine in. There's a couple key populations that our organization, many organizations, will be talking about. Pregnant women, we don't have a lot of data on pregnant women. It's not a population that was intensively studied. So for many organizations and for regulatory bodies, it's important to try to figure out what is the relative risk and benefit of vaccination in pregnant women. That is a group of individuals who are susceptible to complications, and at the same time, we want to make sure that it's safe and effective. There are, of course, with any vaccine, age requirements. In this one, they've advised that it's for individuals 16 and above. There are also some discussion, and I don't think we've heard the end of the discussion about it, about individuals who have serious allergic reactions, particularly anaphylaxis-like reactions. This is a part of the process of making sure that the vaccine is safe. So we, like other organizations, will be making sure that as we're vaccinating healthcare workers, we take those guidelines into consideration and apply them appropriately.
Okay, thank you. Next question, Campbell Robertson, New York Times. Campbell, please go ahead.
Thank you for doing this. So this is sort of for two folks. One, for Dr. Snyder, if you can talk about prioritizing the doses that you get, which isn't enough for everybody, with this first wave, and like who, you know, whether you stagger it within departments to make sure you have enough on staff, and just how you prioritize this first wave of doses. And secondly, Charmaine, you mentioned a vote to decide who would get this first shot. If one of the recipients could talk about the moment that your department decided that you would be the one to get the shot.
As you alluded to, there won't be enough vaccine in the first allocation to vaccinate all healthcare workers. That is the phase 1A group. So we, like other organizations, have had to determine how to prioritize vaccination within our organization. We're excited and optimistic about the likelihood that we'll have enough vaccine very soon to reach all healthcare workers. And so this prioritization is really in these early stages as we're first receiving allocations. How can we do it that's fair, that's equitable, that's efficient, and that's effective? So we convened a group of, a clinical advisory group of experts. These are experts in virus and viruses, disease caused by viruses, vaccines, including vaccine trials, ethics, and many others. And first started with the principles that we wanted to apply. And they're going to sound familiar because it's the principles that our public health agencies are also recommending. We want to make sure that the vaccine, when used, will be effective at maintaining our workforce and maintaining the critical aspects of our healthcare organization so that we can continue to provide care through the pandemic. Additionally, we want to make sure that we are allocating vaccine to those who might benefit from it most. And that includes healthcare workers who may be most likely to be part of transmission, although in our hospitals, I think it's very, very safe to be a healthcare worker with the precautions that we have in place. There is the possibility of transmission elsewhere, including home and the community, and additionally making sure that those who have underlying medical conditions who might benefit from the vaccine, reducing the likelihood of complications of virus infection, are prioritized as well. So we have built a prioritization scheme that takes into consideration those values and starts where the vaccine will have the most impact, both for prevention of disease, prevention of transmission, and maintaining our operations, and gradually work through our prioritization to, until we reach all of our healthcare workers.
Why don't you talk for a minute and then Shar.
First of all, thank you for the opportunity to be here. My name is Dr. Sylvia Wusuwansa. I'm a pediatric emergency medicine physician. I'm also assistant medical director of Pittsburgh EMS. And so when I was first asked to do this, I was extremely excited and extremely honored. As many have said before, to be able to protect my family. I have two beautiful young girls, my husband, my parents who I can't see, who are in Boston, Massachusetts, in this wonderful community of Pittsburgh, the wonderful Mr. Rogers neighborhood. I'm also part of the demographic that, as you know, African Americans have suffered quite the repercussion of COVID-19, and I wanted to share with my community that it is okay, that this vaccine is the thing to do, to keep us safe, to keep us healthy, and to keep us alive. And so I wanted to set that example not only for my family, but for my community as well. And so thank you for this opportunity.
So probably last Thursday, I got a text message from my supervisor, Tina Day, to the group that she was considering for the first shot. We all weighed in, and we all wanted to do it, as I said, and we kind of had a text vote, and everybody thought that I should go first. It was exciting, relieving, and as I said before, honored to do this and appreciative of UPMC to have this. Thank you.
Next question, Andy Sheehan, KDKA. Andy, please go ahead.
Yes, thank you. Thank you for doing this afternoon or this morning. I'm just wondering about, this would be the Pfizer vaccine. I know that the Moderna vaccine was tested here in Pittsburgh. Wondering about supply, and whether you believe that the Moderna vaccine may be coming shortly.
Yes, so we are receiving the Pfizer vaccine in our acute care hospitals, and we'll distribute the Pfizer vaccine into the catchment area of those hospitals. That means the hospitals, the clinics that work with the hospitals, and within their area. We are also receiving Moderna vaccine at our skilled nursing facilities. The quantity of doses and the timing of receipt of this vaccine are still details that are pending. But we're also working, like we did for the Pfizer vaccine, through our acute care hospitals and their catchment areas. We're working to plan out the distribution of the Moderna vaccine for healthcare workers and residents in long-term care facilities. The timing of the receipt and the number of doses is still in flux.
Next question. Jason, oh, he dropped his hand. I'm sorry. Next question. Charlie Thompson with the Patriot News in Harrisburg. Charlie, please go ahead.
Hello. Yes, I wanted to see if I could have any of the UPMC officials describe for us, since there are UPMC hospitals throughout the state of Pennsylvania, how are you determining which hospitals are receiving the vaccine first? Can you describe the methodology or rationale for the schedule of moving it out throughout the network?
Absolutely. Thank you for the question. Actually, the distribution to sites is being overseen by the federal and state governments. So UPMC, as an individual organization here, is notified by the state for when we will receive the vaccine doses. Each of our hospitals were required to go through a very lengthy process of submitting information over the last several months. regarding the number of employees and some of the other details. And then we are just anxiously waiting for further notification from the Secretary and others regarding the receipt in the other organizations. So that's pretty much the process as we understand it now.
Thank you. Next question, Kelly Kasinsky of WESA. Kelly, please go ahead.
Hi, thanks for taking my question. Dr. Snyder, do you have any estimate for the number of UPMC workers that will receive the first dose of the vaccine this week? And to any recipient, are you experiencing any of that arm soreness or other symptoms we might expect from receiving the vaccine today?
I think for the second question, everybody looks okay. Yeah. There's that thumbs up and nods and smiling with their eyes. I think so far so good. There are side effects that we would anticipate from the vaccine. Like any vaccine, this is intended to stimulate the immune system. And based on the published research with the vaccine, we know that some people may feel arm soreness, may feel either a slight feverishness or fatigue or malaise. There are some reports that for the second dose of this vaccine in particular, those may be more severe in that they may make it hard to do a full day's work if your arm is so sore or you feel so fatigued. So through our Human Resources Department, we are already working for the accommodations, understanding that people may need to take 1 or 2 days off as the immune system is stimulated by the vaccine. But those side effects would be a little too early to see them now. Especially given Tammy's excellent technique. I'm sure his shoulders are great. As far as distribution of the vaccine day, we have 90,000 employees at UPMC, and we are optimistic that we will be able to vaccinate all of those employees in short order. That is in the next coming months. Because of the amount of vaccine that has been distributed already and the amount of vaccine that's been promised to come and that we anticipate being made by manufacturers. So this is, again, coming back to the compressed timeline. First of all, vaccines are a miracle of science. The fact that we have a vaccine in less than 1 year since this virus has been discovered, that we have multiple potential vaccines, that we have 2 vaccines, not 1, but 2 vaccines that are already safe and appropriate for human use, and that we have the vaccine here to administer and have enough vaccine that Tammy and I are up here thinking that we're estimating that we'll be able to get to our entire workforce within a couple months is positively amazing. It's positively amazing.
So again, if you have any questions, press the raise your hand icon at the bottom of your page and I'll put you in our queue. I will call on you and then unmute you and you can ask your question. Next question, Samir Nevsy from WJET TV in Erie, Pennsylvania. Samir, please go ahead.
Yes, hi, thank you. So out of the 900 plus vaccines that you guys currently have, will you be setting aside half of that to ensure the availability for these recipients come 21 days from now?
That's a great question. Actually, the delivery process will assure that we will get the second half for these individuals in probably 2 weeks from now. So this delivery is for this initial dose, and then there'll be another delivery for the second dose.
Thank you. Let's try Jason Laughlin at the Philadelphia Inquirer again. Jason, please go ahead.
Yeah, hi. Can you hear me okay?
Yes, go ahead.
Great. Can you talk a little bit about the restrictions that these folks should continue to follow after being vaccinated, as far as whether they continue to be at risk of carrying the virus, even if they may be immune to it themselves?
So with the vaccine, we have some estimates from the clinical trials about when immunity will take place after the vaccine. And for these 2 vaccines, they looked at 1 week and 2 weeks after the second dose to measure the effect of the vaccine. So right now what we could say is at 7 or 14 weeks after the second dose of the vaccine, we know that approximately 95% of people demonstrated immunity and prevented infection. So from an operational standpoint, we're going to use that time point as the time point where we say people, we might safely assume there's a 95% chance that they will be protected against infection. In the meantime, I know there's been some discussion about how much immunity comes from just 1 dose, but we're actually going to be following the guidelines that are put forth, including the manufacturer's guidelines for these vaccines, and give both doses.
How long would immunity last after
So the question was, how long will immunity last? So we know how long immunity lasts only as long as the studies have followed patients through the present. And it's not possible to know how long immunity lasts well past that, because even the clinical trials haven't followed patients for that long. However, there is a lot of excitement that the immunity induced by this vaccine may even exceed natural immunity from disease. So at this point in time, I can't say, but we're optimistic that the vaccine is going to provide durable immunity.
Next question, Kristen Havener from WJAC TV. Kristen, please go ahead.
Thank you. Obviously, a lot of you are excited to get this vaccine today, but I know that there are some people in the healthcare field who are still skeptical given how fast this vaccine was developed and pushed out. What are you doing at UPMC to kind of qualm those issues within your system and to the general public as well? I mean, what is your response to people who say, hey, this is very fast and I'm skeptical, you know, even in spite of the numbers that come out and all the research that's coming out, that I'm skeptical that something this fast is being pushed out to the public and to the frontline workers who are getting this first?
Excellent question. So first and foremost, from when the pandemic began, we at UPMC relied very heavily on our scientists to guide us, right? And our scientists, we believe, are bar none in so many ways. And so from the moment that these studies were started, these trials began, our physicians and clinical researchers have followed this work extremely intently. And they have watched, read, you know, scoured the details associated with this. And so we do believe, and we will be promoting, this vaccine is safe. And we believe that it will, that our employees should take it. We also, though, have recognized that there are those that are skeptics. And so during this initial part of this vaccination process, it will be a voluntary vaccine. We will not be mandating our employees to take the vaccine like we do the flu, to allow folks to hopefully see the experiences that will be occurring naturally over the next several months, to be more reassured that indeed we are very safe and that this vaccine is very effective. So that is the approach we're taking. All of our communications will be very transparent. We started today already with cascading information internally so that all of our employees will see the same information about the vaccine, its effectiveness, our approach, our prioritization. And we also believe that transparency is very key to understanding and gaining acceptance. So thank you.
Next question, Lauren Halahurich. Lauren, please go ahead.
Hi, this is actually Paula Grubbs from the Butler Eagle newspaper. Quick question. Just curious, what is the cost to UPMC for this vaccine? I don't know if do you have a cost for the freezers, et cetera? I don't know if you, the individuals there would know that now.
It's been distributed to us without cost. As far as the cost of what it takes to do this is already built into our infrastructure in essence. And so, like many things related to COVID-19, we have asked many in our team to adapt what they're doing to help us respond to this pandemic. And similarly, we have taken what we have in place to distribute an influenza vaccine to all of our workforce plus the community we serve, and use that machinery and operations to make this happen. So yes, we did acquire some additional freezers to accommodate this vaccine to augment what we already have. But overall, the cost has been in the hard work that people have put in place to make this happen.
And I would want to add that our partnership with the university and the researchers that are there also was very instrumental. Many times researchers use these types of deep freezers, and they have made themselves and their space available as we would need it. So just wanted to say a thank you to them.
Thank you, Tammy. Thank you, Dr. Snyder. Thank you, volunteers. it's most appreciated what you've done for the community and what you've done for UPMC. This concludes our press briefing today. If you have any follow-up questions, please reach out to UPMC Media Relations. And as always, follow us on @UPMC News on Twitter. Thank you very much.